Yeah, thank you so much for those people who commented on my last video. It's really great to get positive feedback that this information is helpful to people, as it has been to my friend Elizabeth, who recently healed from lymphoedema. Now, cardiovascular disease is what I'm particularly familiar with, having recovered from it several times, and it is not a death sentence. So I'm going to take you back to my original diagnosis, which was in 2011, a postpartum cardiomyopathy, and all the feelings that came in that time when I didn't know as much as I do now. Now, one thing you have to know is that doctors are trained to use fear and emotional manipulation. And one of the reasons they do that is they need patients to comply. They need people to see the seriousness of the condition. And while the condition is serious, life-threatening, the body is also very healing. So they can go a little bit over the top, and they also don't provide the tools to... They provide treatments, but they don't provide you with the positive hope that the conditions are reversible. And that is because that's not in their training. So when I was originally diagnosed, I had just lost a baby, and I believe it was related to my heart condition. And there is a condition called Takotsubo cardiomyopathy, and even though that wasn't what I was diagnosed with, I feel it all kind of compounded on itself, as well as having postpartum cardiomyopathy, which is related to being pregnant. I was 39 years old, particularly healthy. I ate organic. We collected water from the mineral springs, and we had... And I really didn't eat a lot of processed food or anything. I wasn't perhaps as great on the exercise, but I wouldn't have considered myself unhealthy. So it was quite a shock to receive the diagnosis that my heart was only pumping half the amount of blood that it should have been, and my body was essentially filling up with liquid, or fluid, sorry. So what happened was, because the baby had passed away, I ended up inside the medical system, and I had reasonably high blood pressure. It wasn't crazy high, but my pulse was over 100. I think it was about 115, and I didn't know it, but I'd put on 20 kilos of excess fluid. So I was admitted to hospital, and the only way that they can actually diagnose cardiomyopathy is using an ultrasound. So all the other things, the blood tests, blood pressure checks, they can do a blood test actually, but it's not definitive. In order to be able to see what your heart is doing, they need to do an ultrasound. Often nowadays they'll ask, they'll like to do an MRI, but as a more, I guess, accurate, doesn't rely on humans to operate a machine, but it's far more invasive. There is a lot more risks involved in the sense that you'll have this toxic dye, radioactive dye, injected into you, and it's certainly something that I wouldn't recommend or use myself, and I have refused it in the past, because I don't think it's as important as simply getting the diagnosis and making the necessary changes in order to heal. And because I've healed a few times now, after I have, I guess, relapsed in my discipline. When I was originally diagnosed, there was no grace given to me, the fact that I was a grieving mother, and they wanted me to be admitted before I buried my baby, and I could not reconcile that, so I left the hospital. And that evening, by some chance, the doctor who had admitted me came to my house and he, in front of all my children, said that I needed to get back to hospital, that I wasn't going to be, that it wasn't that I was going to die in some distant future date, but that it would be, 2011, that I really was in a serious condition. And that even though I was sitting and functioning, fairly normally, because I wasn't actually exerting myself, I couldn't climb stairs, I couldn't lie flat. I had this strange cough that I thought was an infection that turned out to be fluid buildup in my lungs, and my feet were swollen. So there was a lot of indicators that my heart was failing, and as well as my heart failing, my kidneys were failing. Essentially, my body was kind of shutting down. So the use of fear in that instance was probably completely warranted. I mean, I really needed a jolt. But when I went back to hospital and was admitted, I felt that it got to a certain point that I realized that the fear was no longer helpful to me, and I was simply going to just find my own course of action, and that the doctors there really had never gone through heart failure themselves, so they couldn't possibly know that I would be able to recover. I just had this absolute faith that my body was already responding. I was already feeling better after getting some fluid off me, not even a lot of fluid off me. And I just felt in my heart that, hang on a minute, none of these doctors have actually gone through heart failure themselves. And I remember saying to them, one of them said, if your drugs and if your therapies are so good, why are there so many patients on this ward? And he couldn't reply to me. And I realized that all that they knew about heart failure and cardiac issues was simply what they had been taught in a book. And if that information was faulty, if that information was incomplete, then they were not going to be able to help me. They're absolutely lifesavers in an emergency situation, and that's what they did. They were able to stabilize me, stabilize my electrolyte levels, get the fluid off me, and basically discharge me after that with an ACE inhibitor, which expands allows your blood vessels to expand, allowing you to receive more blood flow, and also a beta blocker, which slowed the heart down and essentially gave it time to rest. So those two drugs I took, they're very, I would say they've been around for a long time, and I was taking such a low dose, which was 2.5 milligrams of each, that I felt that they would be things that I could essentially wean myself off, which I did. And also the lower the drug level that I took, because I actually deliberately refused higher levels because it made me feel sick and I wasn't able to function normally. And also I felt that by taking the higher levels, I was also risking my kidneys and my liver, which at the time were under great deal of stress, having been sick for probably a matter of weeks already. So I remember asking one doctor, and I said to him, so will I be able to have another baby? If I had another baby now, what would happen? And he said, well, you'd probably die, and that this condition that I had would be lifelong, and I would be on medication for the rest of my life. Well, I did prove them wrong, and I fully recovered in 11 months at that point for that condition at that time. And I did go on to have another baby, med-free, perfectly healthy baby at 43. And because the doctors really weren't researched about or knowledgeable about women who had pregnancy after heart failure, or even women who do have cardiomyopathy who actually carry a pregnancy, they often see the very, very worst of patients, and therefore they were only basing their assessment of me on what other patients were doing. And I was not doing what other patients was doing. I was going way above and beyond in terms of my nutrition, in terms of healing myself naturally, and with all in all aspects, whether that was sleep, lowering stress levels, daily walking, a plant-based whole foods diet with no oils, using a book written by Dr. Richard Fleming called Stop Inflammation Now. Now, if you do get a copy of that book, it was a godsend. It was actually in my local library. So when I came home from hospital, that was one of the first things that I read, as well as there was another book on nitrogen oxide production being very essential to the heart, and how these things were able to reduce inflammation and give the body enough time and ingredients to heal. Now, in this book, you'd find heart conditions far worse than mine. And in fact, I met a speech pathologist whose father, I think he had like a triple bypass, and yeah, he must have been at 40 at the time. He was certainly a lot older, probably in his 70s, living a very healthy life, healthy vegan life, plant-based whole foods, and he just threw out the medication, never looked back. So look, there's plenty of stories where people have had severe conditions, have walked this journey and equipped themselves with the knowledge in order to heal. Now, if you don't do and make those changes to your lifestyle and your nutrition, then yes, you will have to go down the medical road. There's really no choice, and that involves more drugs, more devices, and potentially you're looking at a heart transplant or early death, pacemaker, all of that sort of stuff. And that's not the road that I wanted to go down. That was a choice that I made, that I did not want to go down the medicalized road. And I was highly incentivized not to do it. And at the similar time, I also met a woman who was through, someone had found me online because I had a website, myheartsisters.com, that was actually running actively, which I am going to try and resurrect. And she'd found me through that and some Facebook groups. Her mother was 65, her heart function was 15%. She also reduced her drugs down to a manageable level. Did all the things throughout I remember she said she threw out all the white food, ate plant-based whole foods, and she used some herbal remedies to deal with any underlying infection, and did daily walking, and she also recovered from cardiomyopathy. I think she did it in 11 months. So anyway, there's plenty of hope out there. It is a condition that is completely reversible, depending a lot on yourself and your inner healing and the work that you're prepared to put into it. So that's all for me for today. I thought if you find this interesting, please do leave a comment, and if you've got any questions you'd like to ask me, I'd like to just set up a dialogue with what people are interested in hearing about, and go from there, because it's probably the best way forward to be able to share my story. Oh, and I just wanted to add, we will be adding Elizabeth's story to healthallianceaustralia.org and also to my website uncensoredwisdom.com. Links are going to be in the description here, about how she healed from lymphoedema using very similar methods to what I did. So that's all for me today.